Welcome to another edition of the Success Challenge. As promised, I did tell you that we have an exclusive today. I've got a guest that I'm going to take some time to just quickly introduce, and I'll give an opportunity as well to just say a word or two to our audience and to those who are listening from home. What we want to talk about today is a conversation that is missing in our society. So much has been happening. We've had a couple of weeks back where one of our big artists in South Africa who has passed, and apparently now it's because of what we're going to talk about today about mental health. So I really felt it's important that we come to the doctor and to speak about mental health. So without any further ado, please join me in welcoming Dr. Nompumelelo Malachi Angoma with us today on the Success Challenge. Doc, how are you doing?
I'm very well, thank you. Thank you very much, and thank you for inviting me.
Sure, it's such a pleasure, Doc. Can you kindly, just for the benefit of our audience, I know you and I know each other very well. Yeah. So maybe just introduce yourself to them, and then just tell them what you do and how long you've been at it.
Okay, so I have been a psychologist for, I think, just over 16 years now. And I've been very lucky that I've worked in different environments, corporate, private practice, consulting. So I've really enjoyed a good career, I think, in those almost 20 years. Yes. I've been doing that, and very fortunate to have had that opportunity.
Yeah. And then on the backdrop of that, we always hear about psychology and psychiatry. Yeah. Is there a difference between the two, or is it the same thing?
Yeah, so there is a difference. Your psychiatrist would be a medical doctor who studied his or her 7 years before specializing. So when they are done with the 6 or 7 years, they then are referred to as a GP, and thereafter they are allowed to select a specialization, and a psychiatrist would have chosen psychiatry as a specialization. We work very well together. In fact, we need each other quite a bit, because although we have commonalities, there are some differences that only a psychiatrist can do. Yeah. That's mostly the medication, and psychologists would look a lot at the treatment, the therapy side, psychotherapy side of it. And so those are very much our colleagues that we work very closely with. In fact, I would say that to get a successful outcome from our clients/patients, you actually need an entire team, and you've got to have a referral base in the interest of your clients.
So you don't work alone.
No,
there's people who you refer people to.
They refer to us, and we refer to them. Psychologist is somebody that's probably done a BSc or a BA and majoring in psychology and another major. They would then have had to go through and do an honors degree, and one cannot practice with just an honors degree. You need to at least have a master's degree, and if you choose, then you go ahead and do a PhD thereafter.
And I do think that it's important and pertinent that we also mention that you did your PhD, Doc. So sometimes these things
many years ago,
we don't mention those, so that's very important. So she did a doctorate and a PhD. The regulatory bodies, is it difficult to get regulated, and how does that work actually?
So the body is the HPCSA, and that looks after anything health within the country. And so psychologists are part of the HPCSA, occupational therapists, doctors, dentists, etc. would fall underneath.
So you don't just wake up and practice and start seeing people.
So you've got to study, then you've got to go through internship, and I know these days there's community service, and one would then have to register with that body.
Yes.
You've got to be recognized as a psychologist, or whatever it is that you do in health, recognized with that particular body, and then you can start to practice. You can practice.
On the backdrop of that, Doc, you see, I was reading something very interesting, and I think Carl Rogers was one of the psychologists who said that in order for therapy to be successful, you have to be willing. You can't be forced to come into therapy.
Absolutely.
Because there's certain things that you won't open up about. So what's your view when it comes to that, when someone says, I need to go and see a therapist? Is it important that they're open and willing to come to see you?
So it's difficult to make changes or to assist somebody that doesn't see they have a problem. And so firstly, I've got to personally see that I've got a problem before I can be open to a process like this, because it is a very difficult process. I think many of us that haven't been through therapy probably don't know just how difficult a process it is. And if I don't see any consequence with regards to whatever is happening with my life and the situation that I'm in, or my behavior or mood, etc., then it's unlikely that that you'll seek help. And if you are forced to come and get help, it's a difficult one, because who's accountable for that change?
Yes.
There's a lot that you've got to be responsible for in the therapy, and if you didn't come on your own, then it's difficult to hold you accountable for it.
So there is a sense of accountability, and you as a person who say you have to do the work as well.
Yes, you've got to do it. It's hard work for the clients. For sure.
And that's one thing I've taken from, just for the benefit of our audience again, this is my personal doc, so I also come here and see her as well. So there are certain things that I'm taking now that she always says that you have to do the work. Things won't change if you don't do the work. But also, Doc, let's try and maybe bring it home with what I wanted to talk about today about mental health. So to the layperson at home who doesn't really understand, how can we describe mental illness or mental health as a whole?
So that's a good question, and I think as psychologists we don't sort of sit back and answer that question for ourselves. But it's when you have to explain it to others, and you've got to explain it to our communities, that it becomes a very important question. It also leads to then how do you recognize that I have an issue or I've got a problem. A mental illness is the condition, any condition that will affect your mood, your behavior, or your feelings, your affect. So you want a mood, the affect, and the behavior. Anything that affects those three, then you kind of know. And it affects your day-to-day functioning. And so this is why I say that people usually come to us where they can see, I've been trying not to seek help, but I can see it's affecting me now. It's affecting my relationships, it's affecting my work, it's affecting friendships, etc. You kind of know that, or school if it's a child. You know that they come looking for assistance there, because they can then see that actually it affects my well-being, and I can't really function the way I used to function, or I've been trying to function, but it's been tough and I can't do it anymore and I need help.
So let me ask the question then, Doc. So it's not something that's hereditary. You're not born with it. It's something that something happens and then it turns into that, or how does it actually work?
So it depends on what it is, and again, you just have such brilliant questions and questions that we need to get out there. It depends. So for a lot of these mental health conditions, there is a predisposition, which means that there is potentially family aspects that are involved there. So somebody, and when we say inherit, I suppose that's that's a different word that I want to try and take clear of, but there is a predisposition from a familial perspective to a particular mental health illness. So depression, so many a times one does a thorough history, because then you kind of check if this is something that has come from previous generations, other people in the family that have it, and often you'll find that is the case. But then there is the environmental aspect, social, etc., how one grows up, the things that I'm exposed to, whether it's at school, bullying, etc., that would affect an individual. So I think it's a combination of both, and we can't downplay either one of these elements. So if there is a predisposition, which means that it could be something that runs through the family, runs in the family, or it's sometimes aggravated. There could be a predisposition, and it's then aggravated, or it shows up through some life experience or something happening to that individual. And often we undermine or we underestimate the impact that these experiences have on our mental health and how lasting that can be. So,
can you elaborate maybe on
so
that?
For instance, we take bullying very seriously. That's a big issue, and we know that bullying can lead to some stress element in the individual for a long, long time. We're not saying that it could turn it into diagnosable disorder, but certainly we've seen some traits of post-traumatic stress disorder in kids that have been bullied and adults that are bullied at work. So
when you're saying post-traumatic, you mean after the effect, and then only they start experiencing changes?
So they start experiencing the changes. They have flashbacks over the event, nightmares, etc. You can see there's a high level of anxiety, etc. So bullying can happen, I think, in any stage of the individual. I know many adults that are being bullied in the corporate world. It's the same thing. So that's what I mean by we undermine or underestimate the impact of some of these seemingly normal things that people are experiencing. Bullying on social media. This is a real thing, and I often I'm not
Twitter
personally
mostly.
I'm not personally on social media, but I can just imagine. Because some of the way it happens is the same as normal bullying. But this one is constant. So there's no, I only get bullied when I'm at school, or I'm only getting bullied when I'm at work. This is constant. And that must cause a level of stress traits.
So in the olden days, people used to get bullied at school or when you leave your home. But now, because of social media, because everything is just on your fingertips, it follows you home.
Absolutely.
And then the repercussions and the after effects become major.
They are major. But naturally, we know that there could be other things that are happening. So one can't isolate social media and say this is why, this is what caused mental health, and only that for someone. There could be a myriad of things. We don't know what sort of childhood the person had, and we don't know, what's happened, the predisposition from a genetic perspective. We've got no idea of that. So, we come with a lot as human beings. And we've got some really great, pleasant things that have happened to us. And we've got some very unpleasant things that have happened to us.
But then, Doc, I'm always curious, and I'm trying my utmost best now to push the conversation as much as I can so that we answer all these important questions. So is there a link to someone who's suffering or who's having issues with mental health and violence? What happens before it gets pushed to that level of violence, where someone gets to hurt someone or hurt themselves? How does it get to that level? That stage?
So what we say there is that we see an emotional dysregulation. So either you are being dysregulated up or you're dysregulated down. And often when we are dysregulated up, those are the emotions with energy, anger, rage, frustration, etc. And
all those heavy emotions.
All those ones that have energy almost. And often we are able to regulate our emotions. So I think we say 90% of the time, as human beings, we are able to regulate our emotions, but then there is that 10% where we really just go over and we become what we call dysregulated. And if we're being dysregulated up, which is where you've got your emotions that have energy, then we know this is where people do things that they later regret, right?
Can we say the triggers?
Pardon?
Can we argue that those are triggers?
Well, they could be. They could be, but I also don't want us to minimize the extent to which we can regulate our emotions. So not sort of say, well, we just people kind of walking down being triggered.
I hear the difference.
Etc.
I hear the difference.
Yes, so certainly there can be what we call prompting events or triggers in society or in our life around us that if I'm not regulating my emotions, I can become dysregulated. if I'm not using a skill, doesn't have to be something that is a formalized skill, but certainly you know yourself. So what do I need to do when I'm in traffic and I can see that I'm becoming enraged and there's behavior from another driver, which is some people put on the radio. They do. That's a form of regulating of themselves. And they kind of know. I know myself. I know my limit. I know, what I need to do. When I can feel anything changing with regards to my emotion, my thoughts, or my body. So basically, what that means is that I know that I have been triggered, or there's been a prompting event when those three change. Suddenly my emotions change. I was okay, suddenly I feel irritation, frustration, and perhaps some people will say I have chest pains, headache suddenly, etc. Then I know there's been a prompting event, and my thoughts become suddenly very negative, and I then become dysregulated up, and I do or say really stupid things. Really. And in the end, most people will see that there is a consequence to that when I become dysregulated. When there's violence towards others, there is usually a consequence to that, and that person will then come for help, because they'll know that actually either the law or they're losing a relationship, etc.
Doc, I'm looking at the time and we're running out because Doc has other patients as well that she needs to see, but I've got 2 or 3 more questions that I want to ask. I do know that one person wrote to me and they said to me, I've tried to speak out. I've been having these issues, I've been having these thoughts, I've been having these, ideas to do certain things that I don't want to do. I've tried to speak to my family, I've tried to speaking to someone at church, and they're all saying, we should pray for you. Your family members are saying, be more stronger, you can get over it. What do you say to such a person?
Look, my comment would be, if somebody came to you and said, I've got some physical ailment, would you have the same response? And I think we've got to elevate our discussions around mental health, and we've got to elevate how seriously we take mental health to the same level. So we almost see physical ailments as a life or death situation, but we don't see mental health to the same extent. And so what we need to do is, however I respond to a physical ailment, if somebody comes to me and says I've got a physical ailment, is the way I'm going to respond with the same level of urgency as I would respond to and help and support, and if it's about getting into the car quickly, because I can see the physical ailment, I can see blood, I can see it's very obvious.
So certain things that would appear.
But with mental illness, it doesn't seem, it seems like, get over yourself. Another thing that people like to say is, just move on. They'll go, just move on. It happens to everybody, etc. But you've got no idea the extent to which that this is actually becoming a real life-threatening issue for the individual.
For the person,
And what we always say, Balu, is this, that most people that end up taking the route, right, where they're becoming dysregulated down, which is the emotions that have very low energy. Such a low mood, your grief, depression, etc. If they become dysregulated, then self-harm becomes an issue. And suicide becomes an issue. And often it's to try and get relief. So they, people that take their own lives, it's not that I want to die necessarily. I just want whatever it is to end. So I want to relieve from this incredibly low, dark place that I'm in, that I don't seem to be able to help. So they almost feel helpless. They're in a hopeless situation, and they feel helpless to change.
And there's no escape.
There's no escape, and they feel that is their only escape. But if they had another choice, of course they would choose life. But in this is how they feel. It's so awful that they want it to end.
Maybe then my second last question. There was a parent who wrote to me, and I presume that it was apparent, because when they said to me that, I have my child at home, and then each and every time I try to reprimand, each and every time I try to tell them this is not the way to do things, they use this now as an scapegoat, or to say, if I don't get my way, this is what I'm going to do. I'm going to take my life. I've had enough. Yes. So how do you then maybe advise or motivate the parent? How do they deal with such a situation?
Look, I think if anybody, whether it's a child, adult, if anyone says I'm going to take my life, you need to take them seriously. So I always see it as, for that child, maybe it's a cry for help. Maybe there are other things that this child is dealing with that we need to be supportive of. But in our field, anyone utters those words and we know that that's a priority, and it's something we always take seriously.
Yes. And so someone wouldn't just say that.
No, I don't. I don't think that people necessarily would, and I try to emphasize that when somebody says that, there's some problem. So maybe they don't want to kill themselves, or they don't want to end their lives, but there is an underlying problem.
Yes.
And let's take that seriously and see if we can give them a level of support. But as a parent, you almost want to be consistent as a parent. And I know as parents, things can be very frustrating and difficult. And so it's easier said than done. But you want to be consistent. You want to offer a structure. You want to all these things that help to create a level of safety and security
for the person,
for the child, from the get-go. And if you need help, then you go and see someone as a parent, so that you can get support. Because sometimes I think we underestimate parenting and mental health issues that come out of parenting a human being, or maybe two or three little human beings.
Well, Doc, before we close off, maybe just as a parting shot, I do know that some of you have written to me and you've sent me so many messages, and it was tough to go through the entire list. But what we'll do is maybe I'll try and convince the doctor to maybe make herself available for our next session that we can have at a later stage, so that we can try and get to some of all your questions that you've asked. But maybe as a parting shot, Doc, maybe at the end you can also just tell us where people can find you, how they can reach you if they want to come and have these sort of sessions. But as a parting shot for myself, we've spoken about how do you get help. Is there medication that you can take to sort of regulate what is out of reach for you? And then maybe lastly, how long should you take medication? Is it something that you should take long, or?
So at the beginning I discussed the relationship that we have as psychologists with psychiatrists. They are the partners in our journey, or in a client's or patient's journey, that would manage that 100%. And so obviously they would have their own ways to determine what sort of medication is appropriate and for how long. And I'm sure that would differ from patient to patient, or client to client.
Or issue to issue as well.
Exactly. But certainly that relationship that we have with each other as professionals is important for these types of reasons.
Thank you so much, Doc. Maybe as a parting shot from yourself, where can people go to find you? Should they maybe go on the internet?
I think that's probably the best way. Certainly, if they type my name in, they'll find all the. They can find.
And then what I'll also do, maybe on the link below, I'll just leave a link with where you can just click, and then it will take you to the doctor's page, and then you can maybe book your own appointments and come and see the doctor. But from my side, Doc, it's an absolute pleasure. Thank you so much for availing yourself.
This is such important work, and the more we talk about it, the better.
Hopefully you can give us another session at a later stage. Thank you so much. Guys, it's been a pleasure. Thank you so much. Please stay tuned for our next episode. I'll give you guys some details at the end. Thank you so much. Have a lovely one. Thank you. Thank you so much, Doc.